You may proceed, please.
Thank you, Mr. President. My personal explanation is on the need to prioritize health and strengthen. My personal explanation is on the need to prioritize health and strengthen effort to accelerate and achieve universal health coverage in Nigeria. Mr. President, the United Nations has designated the 12th day of every December to commemorate Universal Health Coverage Day and raise awareness of the need for strong, equitable, and resilient health system all over the world. Universal health coverage priorities and principles guarantee that every citizen in every community, in every country, all over the world, no matter their socioeconomic status, should have access to quality, essential healthcare services without suffering financial hardship. The federal government of Nigeria has made several commitments and efforts in its journey to achieving universal health coverage. Some of these efforts include Nigeria's signatory to several international treaties and resolutions on health, including the Abuja Declaration of providing 15% of national budget for health. The government for its commitment, we want to commend the government for its commitment and progress made so far in providing access to quality healthcare service and improving healthcare delivery at all levels. I also want to commend the National Assembly for its commitment and key interventions to support universal health coverage objectives. The National Assembly is currently concluding legislative process on the National Health Insurance Scheme Amendment Bill, that is the National Health Insurance Authority Bill, which proposed to make health insurance mandatory in the country if passed into law, and it will accelerate progress towards universal health coverage. However, the Senate should be worried that these conscious efforts have not translated to the desired improvement in Nigeria health indices and outcome, characterized by high under-5 mortality, high maternal mortality, high disease burden, insufficient health workforce, among others. Hence, the current gaps noticeable and the very low pace in Nigeria's journey to achieve universal health coverage. The Senate should also be worried that most of the health policies which were painstakingly developed to advance healthcare delivery and particularly ensure healthcare coverage have recorded low levels of implementation. The Senate should be concerned that Nigeria is currently among one of the countries spending the least on health, despite the huge implication of a health citizenry on the socioeconomic development of every nation. This is the major reason for the unacceptable high level of out-of-pocket expenditure for health, and it contributes to high rate of catastrophic health spending, leading many families into poverty in Nigeria. It has been established, Mr. President, that the number of people living in poverty will increase to 90 million by 2022. This will continue to hamper development objectives with a huge implication on the security and continuous existence of the entity called Nigeria. The Senate should be concerned that the suboptimal public investment and spending for health, as well as the low level of implementation of the health policies, especially the Basic Healthcare Provision Fund, among many other issues and challenges, can hinder Nigeria's progress towards achieving universal health coverage and other related SDGs targets goals by year 2030. I therefore wish, Mr. President, to use the opportunity of this year's Universal Health Coverage Day to call for the following actions. That the Federal Ministry of Finance, Budget and National Planning and Federal Ministry of Health should immediately release and implement approved fund earmarked for Basic Healthcare Provision Fund. That the Federal Ministry of Health and its relevant departments and agencies should strengthen health security infrastructure and fully implement the National Action Plan on health security. And finally, Mr. President, that the Ministry of Finance, Health, and any other relevant agencies should identify robust health financing structure and mechanism that will enable Nigeria to achieve universal health coverage by year 2020. Thank you, Mr. President, for the opportunity.
And also the notice of the general public on the need to prioritize health and strengthen efforts to accelerate and achieve universal health coverage in our country. Surely the COVID-19 pandemic has exposed how weak our health institutions are, and of course also the inadequacy of the institutions. And this means we have to invest more and more and more in the health sector to secure the health of citizens of our country. So I want to thank you once again for bringing this to our notice. Leader of the Senate.